Good morning, everybody. Thanks for joining us this morning. My name is Dr. Proya Oldwoman-Healy, Child and Youth Wellness Specialist with Siksika Mental Health and Wellness. Thank you for taking the time to join us for our Lunch and Learn series that will provide information about funding supports, resource supports, and service provision from various service providers. These are virtual series that will be recorded and later added to the Siksika Health Services Resource Library. The purpose of these webinars are to create awareness on accessing supports that may be available for families and their children. There will be a few minutes for about 10 to 15 minutes afterwards to answer any questions, and this portion of the recording will not be recorded. I would like to introduce to you today's speaker, Tyann Redgun, who is the clinic assistant for the Siksika FASD program. Welcome.
Thank you, Pearl. Thank you for having us. So I will be doing our PowerPoint today on our FASD program. So just a brief intro of who all works in our area. We have our clinic coordinator, Vanessa Buckskin, myself, the clinic assistant, and we have two mentors, Sonia Chief Calf and also Rosario Duck Chief. He also provides resources. So he's the person you would contact if you just need any help obtaining information that we don't have here on the reserve. But let's just jump into it. But a little brief information about our program is we offer a holistic approach. So with that, we have the assessment and awareness and prevention. And we also do awareness across the lifespan for our clients. See. Oh, here we go. So I like to call them the 3 pillars of supports for the entire family for our FASD program. So the first pillar of support is the assessment and diagnosis. So what the assessment and diagnosis process looks like is first is the referral process, which is sent to our offices. And usually where we get our referrals from are from family services, the schools, and majority of them come from the community. So when I say community, they're from the doctors there or the therapist here. That's where we get our referrals from. And then from that, I like to put them all on a list, and then the clinic team will review those. So they'll determine who meets the criteria to get an FASD assessment done. And then once the selection is made, the clinic process will begin. And that's where you'll see more of me. So I like to be the liaison between the families and the doctors and the psychologists. So first and foremost, we like to make sure we have the consent forms that are completely filled out. And that's usually the one thing that I have a struggle with, but this will help me obtaining information from to help with the assessment. So that's from the hospitals, the schools, the therapists, just any place that the child has been seen. And this will help with the assessment portion. And then once we have all this information gathered, we like to set up the doctor and testing dates, and with that being said, like I'll give the parents or the caregivers a good 2 weeks notice. And then from that, it's called our clinic day. And this is where we will discuss the findings that we got from the assessments and through the medical portion. So I'd like to introduce our multidisciplinary team. So we have a family physician who is Dr. Ray. He's in-house here. Oh, and that's what I forgot to mention. What I love about our program is that we have our FASD clinic in-house now. So the parents don't have to be going off reserve. It's a familiar place for them here. And so I like to say that we're setting up our families for success, because it's a familiar place. The kids, they feel it's familiar to them. So they're not too hesitant to come in and do the testing with the individuals here. And also some of them already have a history with the doctors. So that's also a bonus as well. So the child isn't getting, they're not so hesitant to come in. And then also we have our nurse practitioner. She's helps with Dr. Ray, who is Charlene Bruff. She's very well known in our community, so that's also an added bonus. And we have two wonderful ladies who are our registered psychologists, Sue Humphrey and Deb. So a brief outline of what our FASD assessment and diagnostic process looks like. So this can range from 3 to 4 months to complete our clinics. And we like to only accept 3 to 4 kids. That would be our max for the clinics, but that's also including the adults as well. And during this process, there's a lot of steps. So we'll have the caregiver interview that will be conducted, but that's when the child will come in and start doing their assessments with either Suzanne or Deb. And I like to sit down with our family. So we have our questionnaires to be filled out, and our questionnaires are very lengthy. So it can be very, a little too overwhelming for some of our parents. So I like to sit down with them and just go over step by step and helping them fill it out. And that's where I also will do the parent interview and just to get a little bit more information. And that also helps me getting more information for our doctors and also for our psychologist. But, all right, let me just go back a little bit more too. So during this time, we do like to reach out to the biological mom if that is possible, just to also get a confirmation of alcohol consumption through pregnancy. And once we get that, that will definitely, the child will get a diagnosis. But if mom or we can't confirm that, that's where the medical portion comes in. So that's a huge one too. So usually this will take majority of the time too, because we have to really go into their medical records and get their live birth records. So that's a crucial part. But like I said, that's when I will be doing the interview with the caregiver that'll get all this information. And also the second pillar of support is awareness and prevention. So awareness and prevention, what we like to do is we like to do the home visitation and follow-up. And this is done after the child or the adult has had a diagnosis. We, as the mentors, will sit down with our clients or the family as a whole and just provide them one-on-one supports. And that will look like case planning. So how can we support the client after the diagnosis? And that's the time where we will go over the report. And the awesome thing about the ladies is that, or the team, sorry, is they do a big report, but also they include the child's strengths and the challenges that they have. And that's our job, is to read that back to the parents and have them, how we can help that child or the adult in the school settings or at home. And that's where we'll start their, like I said, the case planning. And at that time too, we like to set goals for them. And when I say the whole family, is once the child gets a diagnosis, we don't just look at the child, we look at the whole family, and we're there to support the entire family, because with that good structure, the child is going to have a good success later on in life. So that's why I say it's a whole. And then we also do adult case planning and supports for them as well. So one-on-one, and just setting their goals as well too. So the majority of the adult clients that we get is they're transitioning out of family services, foster care, and we want to be there to help support them. So the one thing that they do request is they would like to get put on AISH. So that's when we'll help them. And if they're not given a diagnosis, we'll set up that to start making sure that we can get them booked into our clinic and just help them get that diagnosis so we can get them onto AISH, and just also just to set goals for them and how we can help that individual as well. And also our program, we like to do community awareness. So yes, you know, with COVID and everything, we weren't really able to go out into the community and do our surveys, but going forward, I like to say that we are going to get back out there, and we are still going to start our surveys up again. And we also do info sessions that we provide to the teachers, agencies. And when I say agencies, that's like, we did a presentation for family services because majority of our clients are from there. And we just like to give them a brief, like FASD 101, you know, what is FASD and how does it look and how can we help that individual? And the one we do for the teachers is the 8 keys to success. That one's the teachers always, when we would go and do those presentations, they really enjoyed that one. And now that we can start going back into the community, I can see these happening again. So when I say school presentations, we like to start from Head Start, so early intervention, so Head Start all the way through high school, who are our high risk population. So we like to get in there, do our FASD 101, and just talk about the effects of FASD and how it is 100% preventable. And we also do support sessions for our caregivers after the diagnosis. So like we said, I would either do the PowerPoint with them, the FASD 101, or we would have our support groups. And our third pillar, what we cover is supports for individuals and caregivers, so across the lifespan. So once this individual reaches 18, we just don't stop helping that individual. We will continue on with our services, and we'll relook at their case and just see, okay, how can we set new goals for you? How can we go forward with this individual? And is this individual given an FASD diagnosis? And if he isn't, or she, we'll start working on that. And like I said, we'll start the AISH application if that's what they're wanting. And how we also support our individuals or the families is we like to do our support groups. So unfortunately, we haven't been able to do these ones for a while, but we are going to start these back up. And they're going to take, we usually would have 2 classes per month. And what it also, the first one we like to do is like an educational or / like craft night with them. But we also like to set up the classes for the new parents that their child has been given a diagnosis. And that's when we'll present again our FASD 101, the 8 keys, and also our FASD strategies PowerPoint with them. But that's just for the newcomers. But in the past, like we've had nutritional classes, we've had like a paint night. So we also look at these classes as a self-care for the caregivers to come in, have a relaxing night, and we, as the workers, will take the kids and have them in a different room, and we'll be watching them, and we'll be doing the same thing, but more tailored to the child, just so it gives mom and dad or the caregiver just a night of relaxation. And because things can get pretty overwhelming and high stressful at sometimes, so it's just a nice self-care night for them. And we also like to do our traditional classes. So we do have a elder who will come in and just to be there, just to be present, or you know, our elder will tell them stories, and we'll teach. We've had in the past berry making nights with fried bread, and the one that previously too, we've had how to raise a teepee. So our class was really interested in that portion. We had it outside. We had an elder come in. We sat inside after we were done putting up the teepee, and we just sat there and they just told us stories. And then afterwards, they showed us how to properly take down the teepee. So the clients enjoyed that. It was a huge success. So I look forward to having those back on again. And what else? Let's see. So intervention supports. We like to help our clients who have been given a diagnosis, because it could be a hard time. We'll go over it because at first it's frustrating, but we're here as the mentors to give them that support for their families. And also we like to go out into our neighbor, we like to go out to the neighboring agencies. So when I say that, that's like the justice, family services, because majority of our clients, yes, are in the justice system, and they can't advocate for themselves. So that's where myself or Rosario or Sonia will be in touch with the caseworker and help them better understand, okay, this is how the client is, this is how we can support them. So they're not just going there alone and not be really given a fair chance. So that's with the justice and family services. And this is also to where we'll give them our presentations. And our FASD resources, there's myself, Tyann RG at siksikahealth.com if you guys have any questions. And the one network that we're linked with is the CFAN. CFAN Calgary, our resource worker, I like to call him Rosario Duck Chief, he has a relationship with them. So anything that is off reserve in the Calgary area, he would be the person to get in contact with. So, and he's a good resource for to grab all that information. He has all those resources on hand, but unfortunately he's not here right now. But if you need that information, you can contact our office here. And that concludes our presentation.
Thank you, Tyann. That was terrific. So once again, the number is 403-734-5687 for the Siksika Health Services FASD program. And the CFAN number there, Calgary Fetal Alcohol Network, is 249-7215. Once again, thank you. And at this time, we will take questions from the audience.